In today's nursing mindset video, we'll discuss a little bit about basic IV administration. So today's nursing mindset is this: think before the drip, think during the drip, think after the drip. When most people think about IV therapy, they picture hanging a bag of fluids or programming an IV pump. But experienced nurses know that IV therapy is much more than just getting fluids into a patient. It's a continuous process of assessment, monitoring, and evaluation. So let's walk through what that might look like. Before you ever connect IV tubing to a patient, I want you to take a moment to think and ask yourself, why does this patient need IV therapy? Are we treating dehydration, replacing fluid losses, administering medications, correcting an electrolyte imbalance, providing nutrition because they can't eat? Once you understand the purpose, it's time to assess your patient. What are their vital signs? What do their lungs sound like? Do they already have edema? What's their urine output? What do their laboratory values tell you? Remember, IV fluids are medications. And just like any medication, you need a baseline assessment before administration. Then, verify the IV fluid and the site. Is the solution correct? Is it clear? Has it expired? Is the IV site patent? Everything you do before starting an IV helps set your patient up for success. Now the fluids are running. Many students think the hard part is over. Actually, this is where your assessment becomes even more important. Don't spend all your attention looking at the IV pump. Look at your patient. Ask yourself, is this therapy doing what I expected? Is the IV still patent? Is the correct amount infusing? How is my patient responding? Continue monitoring things like lung sounds, blood pressure, urine output, daily weights, intake and output. And of course, don't forget the IV site itself. Remember, the pump tells you the programmed rate. Your patient tells you whether the therapy is working. You need to recognize when something changes. So as you're monitoring your patient, always be asking, where is the fluid going? Is it staying in the bloodstream where it's supposed to? Is it helping improve hydration? Or is something changing? Could the IV be infiltrating? Is the patient developing crackles or edema that might suggest fluid overload? Has the infusion slowed because the IV is no longer patent? Small changes in your assessment often provide the first clues that something isn't right. Recognizing those changes early allows you to intervene before they become bigger problems. Many people think IV therapy ends when the bag is empty, but nurses know that's really the final assessment. So ask yourself, did the therapy accomplish its purpose? Has the patient's hydration improved? Are their vital signs more stable? Has urine output increased? Do they still need IV therapy, or is it time to discontinue the IV? Now, if the IV is discontinued, make sure to remove it safely. Inspect the catheter, apply a dressing, and document the patient's response and the condition of the site. Your evaluation is just as important as the therapy itself, because it tells you whether the plan of care is working. So let's think about this nursing mindset. Great nurses don't simply hang IV fluids. They continually ask, what did I see before I started? What am I seeing now? What has changed because of this therapy? Those three questions keep your focus where it belongs, on the patient. So here's my final thought. As you continue learning IV therapy, remember that your responsibility doesn't begin when you spike the bag, and it certainly doesn't just end when the fluid stops infusing. Safe IV therapy requires you to think before you start, monitor while the therapy is infusing, and evaluate the patient's response afterward. Every assessment helps you determine whether the therapy is helping, whether something needs to be changed, or whether the patient is ready for the next step in their care. Think before the drip. Think during the drip. Think after the drip, because that's the nursing mindset. Keep developing yours.